It's natural to feel a shiver down your spine when you hear the word pandemic. We've all seen, perhaps in our lifetimes or through family stories, how swiftly a new virus can sweep across the globe, bringing fear and devastating loss. Think back to the 1918 flu epidemic, a truly sobering historical event. This terrifying outbreak, which struck long before our modern interconnected world truly took shape, caused life expectancy in the United States to plummet from 55 to just 40 years. Globally, it cut short over 100 million lives. It was a violent, agonizing death for many, with hemorrhages and widespread suffering. This wasn't just a distant historical footnote. Dr. David Sinclair noted that his book, Lifespan, released just months before the COVID-19 pandemic, actually predicted a coming pandemic, underscoring that experts have long understood this isn't a new concern but an ever-present one. And today, we face this threat with even greater urgency. Our world is so much more interconnected now than it was a century ago, with people and animals constantly in contact. We've seen how quickly viruses like Zika can spread across continents, affecting vast populations in just a few short years. Even the Ebola virus, though contained in past outbreaks, shows how easily a deadly pathogen can cause widespread panic and overwhelm even the richest nations. As Bill Gates warned in 2017, a fast-moving airborne pathogen could potentially kill more than 30 million people in less than a year. The fear, the swiftness of these events, and the visible suffering they cause make us understandably vigilant, ready to fight with everything we have. The threat we often ignore, the aging pandemic. But here's the surprising truth that Dr. David Sinclair and his colleagues bring to light. While we rightly fear these acute viral threats, we often overlook an even deadlier silent pandemic that affects every single one of us: aging itself. Dr. Sinclair has been tirelessly advocating for the recognition of aging as a disease for many years. He points out that if you look up the medical definition of a disease, it's something that happens over time, causes you to lose function, leads to disability, and can even kill you. Aging fits this description perfectly, doesn't it? Yet it's not typically classified as a disease. Why? Because it happens to everyone. The medical definition arbitrarily states that a condition impacting more than 50% of the population isn't a disease. As Dr. Sinclair puts it, this is outrageous and means we're ignoring the major root cause of virtually all our illnesses. Think about it: heart disease, cancer, type 2 diabetes, Alzheimer's, frailty. These conditions that we spend billions of dollars fighting are, as Dr. Sinclair explains, largely manifestations or symptoms of aging itself. If our bodies could stay biologically young, we wouldn't get these diseases. It's like putting a band-aid on a problem when the underlying cause is being ignored. This perspective truly shifts how we understand our health. When you consider that aging is responsible for the deaths of roughly 150,000 to 155,000 people every single day globally, with about two-thirds of those deaths directly attributable to age-related causes, the scale of this aging pandemic becomes truly staggering. No single acute pandemic, however devastating, has a daily death toll that comes close to this. Yet, we've largely accepted aging as natural and inevitable. We don't rally against it with the same urgency we do against, say, tuberculosis or the flu, which were once accepted as inevitable but are now rare causes of death due to scientific advancements and a change in our collective mindset. Dr. Sinclair uses a powerful thought experiment. If a new fast-acting virus called Line 1, which causes the exact symptoms of aging, were discovered but only affected, say, 49% of the population, the world would pour billions into finding a cure and a vaccine. But because aging affects everyone, we've been in a stupor, allowing this deadliest and costliest disease to continue its relentless march. This denial, as he points out, has hindered research funding and the development of proactive treatments. The age of innovation, a new hope for both pandemics. The good news and the core message of the age of innovation is that we now have the scientific understanding and technological tools to combat both acute pandemics and the aging pandemic. One of the most exciting developments Dr. David Sinclair emphasizes is the rise of biotrackers. Imagine wearing a small, comfortable device, perhaps a ring like the Oura ring Dr. David Sinclair personally uses and has years of data from, or a tiny bio button, bio sticker he has tried on his chest. These devices connected to your smartphone can monitor your body's vital signs and biomarkers thousands of times a second. Things like your body temperature, heart rate, movements, and sleep quality. This isn't just for fitness, it's a revolutionary early warning system. As Dr. Sinclair explains, if a new virus begins to spread, a sudden spike in certain analytes, the things being measured, in a specific area detected by millions of these monitors, could alert health authorities to an outbreak long before widespread symptoms appear. This would allow for rapid intervention, potentially containing a global pandemic before it spirals out of control and saves countless lives. But it's not just for acute threats. This real-time monitoring can also signal subtle changes indicating the early onset of chronic conditions like heart disease, allowing for intervention before a heart attack even happens. This moves us from a reactive sick care model to a proactive, preventative healthcare approach. Of course, this widespread collection of personal health data brings up important conversations about privacy. Dr. Sinclair acknowledges these concerns, noting that medical records are permanent and far more personal than credit card data. He stresses the need for robust laws and security measures, perhaps leveraging technologies like blockchain to protect this sensitive information from nefarious purposes. However, he also believes the societal benefits of early disease detection and prevention will eventually make these technologies indispensable. The recent pandemic, challenging as it was, inadvertently pushed us forward in adopting many of these health technologies, accelerating changes that Dr. Sinclair had predicted would take much longer, like telemedicine and home delivery of medicines. Beyond real-time monitoring, innovations are also transforming diagnostics and vaccines. Dr. Sinclair's company, ArcBio, is developing technology that can detect all known human pathogens in a sample without needing to know what to look for, leading to faster and more accurate diagnoses for infections. We're also seeing a vaccine renaissance where new methods allow for faster and cheaper vaccine development, capable of addressing widespread diseases like pneumonia and potentially other major killers that plague our population. Crucially, Dr. Sinclair's research and the broader scientific community have revealed that aging is not an immutable, one-way street. It is malleable and, in some cases, even reversible. This means the aging pandemic can indeed be slowed, halted, and potentially even reversed, fundamentally changing our experience of health and longevity. In closing, while our fear of acute pandemics is deeply ingrained and understandable, the true battle for health and longevity lies in confronting the silent, pervasive, aging pandemic. The age of innovation is equipping us with incredible tools, from real-time biometric monitoring to advanced diagnostics and life-extending therapies, that promise not just to keep us safer from sudden outbreaks, but to allow us to live longer, healthier, and more vibrant lives. This isn't about extending suffering, it's about pushing the boundaries of health span, ensuring that our later years are as full of activity, joy, and purpose as our younger ones. It's a future that's no longer just a dream, but rapidly becoming our reality.